Good afternoon, everyone. How many of you find migraines one of the most challenging conditions to treat in your practice? Please type yes in the chat if you've ever struggled to achieve consistent results when treating migraines. We have an expert today who will show you how to take care of migraines with Master Tongue points. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. We appreciate you all for joining us today. Allow me to introduce you to today's speaker, who you might already be familiar with, Dr. Susan Johnson. Dr. Johnson has been a leader in the field of tongues acupuncture for decades, with her career spanning nearly 40 years. A primary student of the legendary Dr. Miriam Lee, Dr. Johnson has dedicated her life to preserving and sharing the wisdom of Master Tongue's acupuncture. She has taught thousands of practitioners worldwide and continues to innovate in her treatment approaches for pain management, migraine treatments, and more. Her passion for teaching and her deep expertise have made her an inspiration to practitioners worldwide. Today's class is 5 Powerful Ways to Treat Migraines with Tongues Acupuncture, sponsored by Evergreen Herbs. Dr. Susan Johnson will guide us through a comprehensive approach to treating migraines, incorporating tongues acupuncture, cupping, bleeding, and other techniques. You will learn the TCM understanding of migraines and discover 5 powerful point patterns to address not only headaches, but also associated symptoms like neck pain, digestive issues, and fatigue. By the end of this session, you will have actionable tools and strategies to enhance your clinical outcomes. But before we dive in, I'd like to highlight that eLotus is a treasure trove of resources for tongues acupuncture enthusiasts. We are proud to feature many tongue practitioners on our platform, including Henry McCann, Trenmin Wong, Brad Wisnett, Esther Su, and Robert Chu. Whether you're just starting out with Master Tongues acupuncture or you're looking to deepen your expertise, we have an extensive collection of courses available to help you on your journey. Additionally, we've developed an incredible tongues acupuncture section on Core, our free online resource. This section offers a comprehensive database of Master Tongues points, complete with pictures, detailed descriptions, Dhamma groupings, bloodletting techniques, and more. It's the ultimate tool to enhance your practice, all at your fingertips and entirely free to access. I encourage you to explore this resource at mastertongueacupuncture.org if you haven't already. I'll post a link in the chat room for you shortly to our Master Tongue instructors, resources, as well as Dr. Susan Johnson's information. And lastly, a quick reminder. Please set your chat to everyone so we can all engage in the conversation. And feel free to ask questions in the Q&A box during the presentation. And lastly, the quiz. The quiz will be available by the next business day late afternoon for all attendees who meet the attendance requirements. Now, let's begin, and please give a warm welcome to Dr. Susan Johnson.
Hi, everybody. Just bringing up the PowerPoint here. One second. There we go. Okay. So hi. Wow, I can't see any faces. Do I get to talk to any real faces here? Can we make that happen, Sam? So a couple of things. Thank you very much for spending your afternoon with me. I'm quite confident that you're going to take home some immediate tools for your clinic even tomorrow. A couple of things I'd like to say just from the introduction. I have to say that Dr. Yang Wei-Chia was my primary teacher of Dong's acupuncture for many, 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 many years. I did start out with Dr. Miriam Lee. She was my original teacher, and I worked in her clinic for about 12 years. In 1987, though, we started in 1982. In 1987, Dr. Yang came to her clinic in Palo Alto and began teaching us Dong's acupuncture, also herbs. And he did that for a couple of years, and he would come up from Los Angeles twice a month, and we refined our point location and needling techniques with him. So I have to say I was lucky enough to have two primary teachers of Dong acupuncture, but Miriam was Master Dong's student for a very short time and Dr. Yang's student for a very long time. So both people were instrumental in teaching me this system. There was one other point I wanted to bring out. Oh, the name Dong. It's Dong. And I knew this would happen, but early on in early 80s, Miriam Lee had put out a book, Dong Acupuncture, and we had talked about the pronunciation because people were, when you spell it with a U, T-U-N-G, people were saying Tung or Tung, and it's actually Dong. And so Miriam and I agreed to have the title of her book, Dong Acupuncture, Tongs. And Dr. Yang, a couple of years later, said, Master Dong chose Tungs, or Tung. And in honor of his wishes, we should go back to that. So we did. But from that point forward, people say Tung or they say Tung, but it's really Dong. It's ding dong, like Dong, like the Tao. Okay, so I feel like every class I have to make that distinction, because if I don't tell you here, it just continues to be Tung or Tung. And yeah, in respect of him, I would like to keep it Dong. So here we are. There are many different ways to treat headache, and this class, those of you who have studied with me already know that I am not shy with acupuncture needles, with acupuncture treatments. My treatments are strong, and some of you are going to see things today that will probably shock you. And if you have not seen bleeding techniques, you have to be prepared for that. I hope you didn't eat lunch too recently. But we're going to start out with a bang, because when I'm treating migraines, I'm going to ask myself right away, do I need to cup this person? It's usually going to be a yes. Do I need to bleed this person? Because bleeding and cupping are really the quickest way to make the biggest change. Not that the needles won't. Okay, the needles absolutely will. They'll make a change right away. But a lasting change, when there are issues of stagnation, will be better acquired with bleeding and cupping in addition to the needles. Now, I won't do cupping and bleeding on the same day. They're both kind of intense, not necessarily painful, but I'm going to be very careful when I take care of patients that I'm cupping or bleeding. Well, I'm careful with everybody to make sure that their blood sugar is good, because you don't really want to do a powerful treatment with somebody with low blood sugar, because your treatment will take energy from them. So, it's going to give them far more than it will take. But at the same time, you don't want anybody feeling woozy when they get off your table. I never do cupping and bleeding without also needling, but I always do those techniques first. And then we move into a needle pattern, and they lay on the table for an hour or 45 minutes or maybe a half hour. We'll go into some of that as we go through the points. But I want to be able to observe them after I've done bleeding and cupping to some extent. And I want to know that they're walking out of my clinic feeling much better than they came in feeling. So if someone has not eaten, I will always give them a teaspoon of honey, a handful of almonds, a power bar, a protein bar of some kind. I will make them eat something because, and I train my patients to know that that's expected. And if they haven't, they know they have to tell me so that I can feed them something that will ensure that after, an hour's worth of working on them, sometimes even longer, that their blood sugar is going to be better, not worse. Sometimes they'll not leave the office and go straight home. So maybe they don't eat for another hour or two. If their blood sugar is low, then when they leave my clinic, they will not feel good. And I don't want that to happen to anybody or to you. So pay attention to that, especially if you're cupping or bleeding. All right, so in most cases with migraine headaches, I will want to cup the neck and shoulders of the patient, but it's not necessarily what I'm going to do on the first visit. It just depends on the person. Some people are very ready for that, not afraid of that, but usually in the first treatment, they're checking me out, I'm checking them out. I'm trying to get their number and they're trying to figure out if they can trust me. So I'm not likely to do a procedure like cupping or bleeding unless I feel like they're 100% on board. And usually after I do an intake, I'm going to talk to them no less than 20 minutes, probably more like half an hour. If it's a very complicated case, it might even be longer. I'm going to get their pulse and their tongue. I'm going to ask pointed questions. I won't just ask random questions, but my questions will help them to learn that they can trust me, that they know that I see what's happening with them, and that I will be able to help them. Before I do any kind of treatment, I want them on board with me. I want them to know that they're in good hands and I'm going to take very good care of them. So I'm not just going to start slapping cups on anybody, all right? I'm going to take a history, I'm going to learn about them, and then we'll decide at that point. However, I'd say maybe 50% of the time I will do a cupping technique in the first treatment. And then maybe only 10% of the time will I bleed the first treatment, unless they have heard of me already, they've got family members who come to me, they're already familiar with my techniques, and they want to be bled. Okay, bleeding is an extraordinary tool, and some of you may have done that. Some of you may feel like you'll never do that, but you should know about it. And it's not rocket science. It's not hard to do, but you do need to see it. You need to get some experience with that. Actually, if you go to my website, you'll see a whole course on bleeding, so you can do that. You probably on eLotus there are probably bleeding courses as well. So we're going to jump right in. All right, here we go. Well, thought we were going to go. Okay, so this picture I call cupping round 2. And the reason I've included this is because I want you to understand, really visually even, what the cups actually are capable of doing. So what you're looking at here is the second round of cupping on the same patient. This is a selfie taken by the patient in her bathroom mirror of her back after her second round of cupping. And what you're seeing, let me grab a tool that won't go away. Let's see, a laser pointer, we'll go with that. What you're seeing is on the first round of cupping, I cupped her upper back and neck down to about bra line. All right, we're not showing the neck here, but what I am trying to show you is multiple things. First of all, these are cup marks from the first round of cupping. All right, does everybody see that and understand that? These are cup marks from about a week ago. Now you can see her cup marks are very dark. The ones like this that were just done the day the picture was taken show a great deal of toxins. Well, the upper back and neck were just as dark. What you're looking at in this cup is the gap that was left from the first round of cupping. Now, if you notice, my first round and my second round cups are put on in triangles. Can you see that? This is a triangle. And these gaps are unavoidable. If they were avoidable, believe me, I would avoid them because the toxins are still there. This is a gap. Okay, this is a gap between the 3 cups that were put on in the first round of cupping. This is a gap. This is a gap. So you can see that the toxins are still there in between the cups that were put on previously. And those gaps are created by the plastic lip of the cups that butt up against each other, or the part of the skin that is slammed up against the side when you put the suction on. I always suction as tight as I can. I want to get as much out as I can. So the skin that is up against the edge of the glass or the plastic is not going to be drawing any toxin, nor will the space underneath the lip of the cup. So that's why you get these gaps. Okay, if we were cupping in squares, for example, you'd have a much bigger gap. Can you see that? And this person is so dark, she's so toxic that her body made this little toxin pull up in the small space between the rims of the cups. This is what she did just from the pressure of the pull on the cups. Here's another one right here. I think there's one more somewhere. Yeah, down here. There's another one. So this is a very toxic person. As it turns out, this person was eating meat 3 times a day. She lived with her grandmother. Her grandmother was feeding her constantly, and a lot of protein, too much protein. So anyway, so the second round of cups are done while I can still just faintly see the first round, you know, here and here. You can faintly see the leftover cup marks. Now, rarely are you going to see cup marks a week later unless they were very, very dark. So, and some cup marks will last even up to 2 weeks. So, you want to try to cup again while you still have the visual so that you can catch those gaps. Okay, so I know how I typically will cup someone the first time, and then when I cup them the second time, I'm going to stagger those cups just a little bit so that I can get the rest of the toxins out that I missed previously. And then from the kind of bra line, this is about T7 down, these are all new cups. Now let's look at these cups. Okay, right next to each other, we've got one that's really dark, really dark, and then one that's not so dark. Down here, there's hardly any color at all, just a tiny bit. So when you learn to be a good cupper, you cup follow the color. You're following the color of the cup. So a cup that's, you know, like this, I'm not going to worry too much about the surrounding area, but a cup like this, I'm going to need to cup all the way around that. And you can see by the color where the toxins are. The color in the cup tells you how bad the toxins are. Now I have a little wrap that I go through with people, and I'm explaining why I'm cupping. I will explain that it's diagnostic as well as therapeutic. It's going to tell me 3 things. Number 1, I'm going to cup an area that's slightly larger than the part that's bothering them, and it will tell me exactly where the problem is, because where there's no blockage, there's no color. There's not a lot of blockage down here, interestingly enough. But her toxin area, we'll go into that a little bit more, is very dark. So it's going to tell me where the problem is. It's going to tell me what kind of problem it is. Because if a cup colors, it's because there's either toxin buildup or muscle spasm in the muscles or in the joint. When there's no color whatsoever, it means it's either a nerve or a bone issue. And sometimes there will be spasm or toxin buildup on top of the nerve or bone. But if you don't get the toxins out, it's hard to get to the nerve and bone issue. And if you cup and there's no color whatsoever, they may not feel better. This is not a muscle spasm. This is not a toxin buildup. This is a nerve or a bone problem, and you have to go a little deeper. If they color, that means they're going to feel enormously better right away. Almost everybody, unless it's bone or nerve. but usually that won't color. So it's going to tell me exactly where the problem is. It's going to tell me what kind of problem it is. And it's thirdly going to tell me how bad it is. Because when it's really black, like these, okay, these are black. This is what I would call black. They can be even darker, actually, but those are pretty dark. We know it's been around for a long time. All right. We also know that it's, oh, I forgot what I was going to say. Anyway, I'm trying to remember what I was going to say. But anyhow, it's you're gonna get that from me now, and you're gonna see movies with me 20 years ago. You know, when I didn't have the slightest bit of menopause brain, but now I do. Welcome to my world. So I'll be forgetting things on occasion. But anyhow, just to say, the color will tell you how severe the issue is. If the color is like this is not where her problem is. This was a patient with autoimmune disease. She had rheumatoid arthritis and was about 34 maybe when these pictures were taken. She responded very well, by the way, so don't shy away from cupping. Cupping is one of the best ways to go about treating pain that I've ever seen. Second only to bleeding. All right, so that's why we're jumping in right here with some cupping. The next picture I'm going to show you will also be a good learning tool for you, because this photo was actually taken during one of my cupping classes. And this is Eric Renaud, if any of you are familiar with him. He's my co-author. But he had been cupped by someone in the class. And so I'm going to show you a few things that this picture shows, which the other one doesn't. We want to look where the darkest color is and be sure there's no gaps around the other color. And you can get rid of these gaps by waiting until these cups come off and then cupping again. When you do a gap cup, you don't need to leave it on as long because it's cupping areas that have already been cupped. But when it's really dark, the color will come out very quickly. See how this one's kind of light and this one's kind of light? This is not a real dark cup, nor is this one. So I'm not going to worry a whole lot about this area. Okay, I might cup it if the patient is traveling from out of town, you know, it's somebody's parent, they're visiting, I'm never going to see them again, or not for some time, then I may go back and catch those gaps. But for sure, I'm going to want to catch this gap, because this one is going to be dark. And we know that because this part is dark, and this part is dark, over here is dark. So we follow the color. Follow the color. These are dark enough that I would not have left this gap. This was a student's first time cupping. I think they did an excellent job, but they still left a lot of gaps in areas like this place where I would not. Dark, dark, dark. I'm not going to leave this gap unless I'm planning to cup them the following week. Then maybe I would, or if they've had enough. You know, people get burnt out after a time and they're ready to stop. So you have to kind of hedge your bets on how much time you've got. You have to track the person's breathing when you're doing cupping. Many of you know this stuff already, but if I'm going to talk about cupping, I really have to talk about the cautions involved with cupping, because this one is very, very important. You must track their breathing. If they are breathing in and out, in or out of their mouth, you have to stop them, because the next thing that happens is they're going to hyperventilate, get woozy, get numb around the mouth or fingers or something, and pass out. If your cupping is intense and they're not used to having it, it's their first time, then you want to be very careful about their breathing. Most patients aren't thinking about it. They just start reacting to the sensation of the cups. So I start in kind of slow. We're going to see a movie of a cupping session that I've done, which will give you a lot of information too. But I also want to point out in this picture, see how dark the front edge of this cup is? Well, this student could have gone even closer to the earlobe. There's a little gap right here that they shouldn't have left. Same here. You can see here's the back of the ear, this little line that you see, and here's the edge of this cup. These should have been done exactly up to this crease, and this cup should have been done exactly up to the back of that earlobe. You don't want to cup the earlobe, that's not useful, but you pull the earlobe forward and tuck your cup as close to the ear as you can, to the temporal bone here, temporal bone. But what I've noticed over the years is that there are multiple toxin areas. We call the area on the outside of the scapula poison points, DTO 1 and 2 in your books. That's the primary toxin area, but there are several others. Another important toxin area is as close to the earlobe back here as you can possibly get. It's the strangest thing, but notice how this cup is only dark on the front side, even the top and front side. If it were a little bit closer, you would see a solid dark cup. So in this way, it does show you that this part of the cup didn't color at all. There is a toxin area right behind the ear. For some reason, I don't know, I don't really care. I always want to cup that spot. Here's another one. This is what I would call a toxin area. It's kind of right where the neck and the shoulders meet. So those cups are going to be coming off the body at an angle like this. An angle like this means you're exactly targeting that junction between the neck and the torso. And there's an area that is very dark that I would call a toxin point. A toxin point also is characterized by a super dark cup, but not a lot of pain. Nobody comes in and says, oh, this spot right behind my ear is really painful. Hardly anybody would say that. You know, not too many people will come in and say this exact spot where the neck and shoulders come together is really painful. Some people might. But, you know, generally speaking, toxin areas are areas that collect toxins that the liver can't process. Our primary toxin area is on the back in this area. Okay, this area is called the toxin area or the poison points. That is an area where the liver will deposit, like a storage depot. You know, it's a storage dump for the liver for what it can't handle. So when you cup that area, you're actually freeing up the liver by unloading the toxic burden from the liver. So I keep all my patients clean. I mean, everybody in my practice is cleaned out at least once a quarter usually. And people that have a real issue are going to get cupped until they stop coloring, which people do. They don't just keep coloring and coloring and coloring. Usually I have to cup somebody 3 times. The first time I'm going to get 80% of the gunk, which is right here and the picture before. And then the second time I'm going to come back and catch those gaps and do the rest of the cupping. Now this person I cupped the very first time I saw her. She came from a Chinese family. She was Chinese, lived with her grandmother who was Chinese, who cupped her and the rest of the family. Not regularly or anything, but had done that. So she was very familiar with cupping and moxa and all that stuff. So she was up for it. But even still, I'm not going to thoroughly cup a neck and the entire back down to the sacral, actually down to the coccyx. I'm not going to do all of that in one session unless I've already cleared all this gunk out previously. If somebody is very experienced with being cupped, then you can cup the entire back at one time because you've already cleared this out. I mean, this is, 30 years worth of gunk lodged in her muscles and joints. So that's why we want to do the top half and then the bottom half. Go at it easy because all of these toxins are going into the bloodstream now. After a cupping session, for the next 24 hours, their body is clearing those toxins. So through the liver, through the kidneys, out the urine in the bowels, normal, avenues of excretion.